Hello, and a very warm welcome to the health webinar brought to you by JKYog and Radhakrishna Temple of Dallas. Medical emergencies can happen anywhere, at home, at the city street, at work, at a game, etc. With medical emergencies, time is of the essence. Almost 90% of the emergency cases can be resolved if the victim gets the right medical care within the first hour. But medical emergencies can be petrifying, especially if you are unprepared. Knowing what to do will give you the confidence to act quickly and calmly. To guide us on how we can be better prepared when dealing with medical emergencies, we have with us today cardiologist Dr. Kanti Agrawal. Dr. Agrawal has been in the active practice of cardiology in the Garland, Dallas, and Plano areas for the last 38 years, participating in hospital outpatient and inpatient care and general as well as interventional cardiology. He obtained his medical degree from AIMS, New Delhi, and then completed internal medicine, followed by cardiology training in the late 1970s and early 1980s. He has been actively involved in the teaching and training of medical doctors and has had extensive interaction with emergency room physicians. He has conducted numerous health fairs in various communities and spearheaded the free health clinic in the Dallas metroplex. He has made presentations to a diverse group of audiences on varied topics such as philosophy of medical practice, pros and cons of choosing a medical career after college, besides introduction of new breakthrough medical therapies to other doctors. A few years ago, he also graduated from the Medical Leadership Program by Texas Medical Association and UTD. He has been an active participant in the health webinar series at the Radhakrishna Temple, working closely with Dr. Kanti Agrawal. A quick note before we get started, we will have a brief Q&A after the presentation. So if you have any questions, go ahead and submit your questions in the chat window. With that, I am delighted to welcome Dr. Agrawal. Dr. Agrawal, thank you for joining us. Over to you.
Thank you so much, Poojaji. And Ragini ji, thank you for that kind introduction. And I think that we'll have a good evening with all the audience members, both in North America as well as those in India. So be prepared to spend some time and learn what we can pick up on this presentation. And please be prepared for some questions and answers. I would like to actually start this presentation with a little short story. In fact, it is not a work of fiction. It is actually a fact. It's a history. Way long ago, there was a prince born to a very rich king in a large kingdom, and his mother unfortunately died within a week of his birth. The father actually got some saint to come by and bless the young newborn, and the saint said that either this boy will become a great king or he will become a great leader, a spiritual leader. The king wanted him to become a great king, so he actually provided all luxuries at the castle, at the palace, and shielded him from outside world. At the age of 16, he got married, and he had a son, and his son's name was Rahul. Till about the age of 29, he was involved only in the palace, and he did not see the outside world. He had his personal chariot and a personal chariot driver. He actually made him drive through the cities, the city streets, and actually wanted to have a joyride. During his joyride, he actually ran into somebody who was walking slow. He was stooped over, and he was actually walking with a cane very slow. And the prince did not understand what was going on. He asked his chariot driver, "What's wrong with him?" And the chariot driver said, "Well, he's an old man. He has lived pretty long, and now he just is a regular aging. So it perplexed him, and he said, well, let's go back to palace. He went back to palace, and he pondered over, and he just could not fathom why this person had aged. A couple of days later, he took another joyride, and during that ride, he ran into somebody who was actually lying in a cot, crying. He was in misery, probably from some kind of intractable pain. He had tears flowing down his eyes onto his. He looked to be in distress, and again the prince asked the chariot driver as to what happened to him, what's wrong with him. And he said, well, he is ill, he is sick, he has got some disease. Again, this was a surprise to the prince. He came back, thought over, and a couple of days later, he took another joyride. This time, he ran into a funeral procession. During the funeral procession, they were carrying the corpse on the shoulders of 4 heavy men. He said, what happened to this man? Why are they carrying him in the shoulders? And the chariot driver said, well, he's died. He's dead. So he said, what do you mean he's dead? Well, he says he has departed from this world, and he may come back in the next life in some form that we don't even know about. Well, that was too much for him. He came back to his palace, and few days later, he took another joyride, and this time he ran into a very calm, very saintly ascetic who was sitting underneath a tree with hands folded and eyes closed. He was in meditation. He looked in perfect peace. Again, the chariot driver introduced him to that ascetic and said, he is an ascetic. He has renounced the world, and he is basically praying the God, and he is actually at peace with him. Well, that led the young prince to understand the life, the old age, the disease, the death, and how somebody was dealing with that. He was nobody else but our Buddha. He was Prince Siddhartha, Gautam Siddhartha, all known to us. He is the man who actually renounced the great renunciation. He attained enlightenment. He preached his philosophy to the whole world, and the Buddhism became one of the most prevalent religion during his time, and this was 500 years BC, before Christ. And till the time of Ashoka, who was 200 years AD, there was a tremendous increase in the number of Buddhists following his principles. When I was looking at his principles, there were 4 noble truths that struck me. That religion says 4 noble truths. First, life is suffering. Number 2, cause of suffering is craving. Number 3, the end of suffering comes from the end of craving. And number 4, there is a path which leads one away from craving and suffering. And he actually showed those paths, and they were 8-fold paths. Again, we are not going to go into the details of all that. All it shows that the mankind has always been bothered by diseases. They have come to terms with the aging and death. Those are absolutely inevitable, and nobody actually bothers, nobody is troubled in life by aging or death. They are bothered only by pain and suffering and diseases that come along with the aging and the diseases. So, what is disease? Well, disease occurs when there are tremendous definitions. Everybody has their own concept. And yet, this is probably one of the most resolved definitions. Disease occurs when the natural inner comfort of mind and body gets disturbed. and the body loses the state of equilibrium. I know it's a very abstract description, and yet it fits in with everything and anything that we know that the body suffers. Body is not made perfect, even though God has made it. If it was, it will be indestructible. Talking about the kinds of diseases. All right. So some of the diseases are genetically determined, meaning that it is in your genes. It's encoded. They are multigenic disease. They're complex array of diseases. We don't understand many times as to how these genes get affected and get transmitted from generation to generation. Those diseases could be very simply like a hemophilia, could be like a hypertrophic cardiomyopathy, cystic fibrosis. There are several diseases which actually are genetically determined. In fact, when we take family history, we ask the patients whether they have family history of heart disease, stroke, diabetes. We know that if they have that family history, they have a higher likelihood of getting those diseases. So they are somehow genetically determined, and they are polygenic. Multiple genes are involved. In fact, if there is a tremendous controversy, there's a tremendous incompatibility with life, these abnormalities result in spontaneous abortions. So a lot of abortions that occur spontaneously are a result of very complex disorder in the genes. There are diseases which are called congenital diseases. They are abnormal development physically. They are in the general category of what is called cerebral palsy. The child is born with deformities. Spina bifida, for that matter, is a structural abnormality. The spine does not fuse in the back, and the spinal cord is exposed. There could be a whole host of diseases which are congenital diseases. Especially in the field of cardiology, we see that people are born with most frequent congenital disease is what is called bicuspid aortic valve. The aortic valve has 3 leaves. They are born with only 2 leaves. It's just a developmental abnormality. It is compatible with life. It's compatible with full life, as a matter of fact, in many instances. They are congenital diseases. There are congenital diseases which are actually related to chemical imbalance. There is chemical abnormality there. They are not able to metabolize certain products of carbohydrate like glycogen. They are not able to metabolize certain. They are not able to secrete mucus without being too tenacious and thick. These are chemically dysfunctional component, and those diseases are again congenital. There is some problem in the translation of the synthesis of DNA and RNA in the fetus. In vast majority of diseases that we come across are what is called degenerative disorders. Well, basically what it means is a deterioration over time. Each and every system of the body ages and decreases its function with or without structural changes. And the commonest conditions that we all know are like hypertension, diabetes, heart disease, coronary artery disease, stroke, seizures, cataract, thyroid problems, Alzheimer's, vascular disorders. They're all diseases which occur as a function of deterioration of the body systems. And many times they are not completely controllable. They may be controllable, but they're not preventable completely. Body portions can be damaged from infection from external biological pathogens. They are biological pathogens. They are all the way from protozoans, which are like a single cell bacteria, very complex. In between comes viruses. There are a lot of other nematodes and all other things that are associated with damage and infection. There are conditions caused by factors like a bad diet, like obesity, lack of exercise and sleep. Those conditions predispose you to have the disease. And there are certain diseases, like we have talked about sleep apnea, early degenerative arthritis of the joints. They're all related to the factors which are within one's control. but it goes out of control. Diseases can be caused by toxins, poisons, overdose of medications. The disease is caused by physical causes, falls, injury, attack from animals, attack from humans, including attack from self, like a suicidal attempt. So these are all, they can cause physical injury and disease. Very important category is a immune system of the body. If there is an inadequate immune surveillance, either overexpression, meaning too much of immune response, or too little immune response, both of them are related to diseases. Examples of very severe immune response, overactive immune response, where the body tries to fight with its own components, own cell components, own structures. They are called autoimmune disorders. And autoimmune disorders, the typical example could be rheumatoid arthritis, lupus erythematosus. They are called collagen vascular disorders. They are related to over destruction of the tissues due to overactive immune response. Underactive immune response, are a typical example could be like a HIV, human immunodeficiency, that caused by virus, that the immune response is tremendously impaired, and they are prone to getting all sorts of infections from unusual bacteria, unusual fungi, and they have a premature death because they have a severe pneumonias. And so the immune response is absolutely necessary for body to fight these external pathogens. Most of the time, the body is able to fight it out. And that's how we get better after getting an infection, even things like malaria, even things like typhoid, simple viral upper respiratory infections. We are able to overcome them. Immune system of the body assists in getting rid of it. In fact, the cancers, which is a major category of diseases, is considered in some way related to the damage of the cells caused by internal or external factors. Though that damaged cell goes out of control. The body has a system of controlling the growth of the cells, proliferation of the cells. If some cells become run away and they grow and grow without body's control, they are called cancers. Normally, the immune system of the body is able to detect those bad cells and able to kill them. In fact, that process goes on every second, every moment, every day. 99.99% of these cells are destroyed very unknowingly by the immune system that we never even know. And that's how the cancers don't occur in 100% of the people. But one such cell that goes beyond recognition and goes and becomes a cancer. So the cancers are actually some way related to the deficiency of the immune system. Well, once we have discussed all those diseases, what constitutes emergencies? Again, there is a lot of definitions. Medical emergency is an acute injury or illness that poses an immediate risk to a person's life, body, or long-term health, sometimes referred to as a situation called risk to life or limb. So diseases can occur, they can linger on, they can keep disturbing the peace of the person. And yet there are situations when it becomes acute, it becomes life-threatening, either to life or limb. That's what the medical emergencies are best defined as. Those usually require prompt attention, probable call to 911, visit to the emergency facilities, and they require immediate workup and management, possibly even admission to the hospital and ICU care. We are going to learn the warning signs. Now, the medical emergencies, how to deal with that? Who deals with medical emergencies? Well, of course, the patient and the patient's relatives, patient's friends. Medical emergencies are also dealt in a day-to-day life by the paramedics. They are the ones who actually respond to these emergencies. They are the ones who deal with them. And ultimately, the medical personnel in the emergency room, in the hospitals, they deal with the medical emergencies. So we have a three-pronged approach to the management or dealing with medical emergencies. On the part of the patient or the patient's family, what are the warning signs? One of the most common warning signs is breathing trouble, unable to breathe, unable to catch breath. It could be if it is acute, severe, and progressive, and especially associated with symptoms like chest pains, vomiting, sweating, cough, and or choking, or changes in consciousness. The same breathing trouble which may have been going on, it takes a lot more serious form if it is associated with any one of them or all of them. And that is life-threatening, immediate threat to life, and that immediately requires visit to, call to 911 and get to the nearest medical facility. Choking. This is an example of choking. This is a current approach by a doctor. Well, the second warning sign that I'm going to talk about is the chest pain. Chest pain could be very minor, or it could be very severe or very dangerous. A chest pain which occurs like a soreness, like after lifting some heavy stuff, moving objects, doing exercise first time, doing weightlifting. That may be just a muscular strain. It could be a chest wall pain, but this is chest pain. But when they are associated with other symptoms, like we talked about, breathing trouble, vomiting, palpitations, dizziness, sweating, and if it is acute, severe, and progressive, it could be indicating one of the three major conditions which are associated with chest pain. Acute heart attack with a damage to the heart, acute blood clot going to the lungs, called acute pulmonary embolism, or it could be tear of the major vascular system like aorta. It's called aortic dissection. It could also indicate something like a pneumothorax, where there is a sudden rupture of the lung tissue such that the air leaks between the air sac, the air covering, the lung covering called pleura, and the lungs. And if that air leak becomes continuous and progressive, it can immediately cause life-threatening situation. The chest pain could be described as either pain, sharp pain, or chest pressure or chest tightness or uneasiness in the chest. And if especially midline, all the way from the pit of the stomach up until the jaw, if it's the middle, and especially if it radiates, it is very suspicious for a origin from the heart. Palpitations. Palpitations could be just nervousness. Palpitations could be just be minor. It could be just anxiety. And yet, when it is associated with severe palpitations, dizziness, weakness, sweating, the same palpitation could be indicating a major arrhythmia, a major heart abnormality. And that palpitation needs immediate attention. In fact, if it is not checked in a timely fashion, it can result in even a collapse and a situation where it requires cardiopulmonary resuscitation. So the palpitations are not to be taken lightly. Severe or persistent vomiting, especially most of the time it's a yellow, previously ingested food. It could be green. Greenish is because of bile mixing. The bile is in the first part of the intestine called duodenum. When the duodenum bile regurgitates, comes back into the stomach and is vomited, it is anti-peristalsis, what they call. The motion of the intestinal tract is going in the wrong direction, and it's indicating a severe condition. Red is major flag. Red is bleeding. When you bleed with a vomiting, it's called hematemesis. It's indicating a peptic ulcer or tear or something very severe like a tumor. It has never to be ignored. It needs immediate attention. Changes in the mental status, speech, face, or limb weakness, any of these in any form, which is noticeable either by the patient or the closest person, the family member or the friend. It is indicating onset of stroke. You never know when it first begins, whether it is going to last few seconds, few minutes, few hours, or it's going to result in a major catastrophic event. So depending upon the duration of these changes, it could be a simple thing called TIA, transient ischemic attack, or it could be a full-blown stroke. Stroke could be caused by either blockage of the artery because of the blood clot, or it could be due to blood clot or some other tissue moving into the vascular system into the brain. It's called embolism. Or third, it could be because of the hemorrhage, bleeding in the brain itself. All these three conditions are life-threatening and they are not to be ignored. Any bleeding from in the skin or any body orifice, be it be eyes, nose, throat, urine, bowels, if it is bright red, very dangerous. When the bleeding begins, you don't know how long it's going to be, how severe it is going to be. That bleeding, if it is easily manageable, stoppable by manual pressure while you see it, well and good. If it is coming from inside your body, there is no way to control it. It needs immediate seizures, convulsions, where there is a motion of the body, hands, arms, legs, with or without tongue biting, with or without control of bowels or bladder control. Those are called tonic-clonic grand mal seizures. But there are different forms of seizures. The tonic-clonic motions, it may not be evident. One could suddenly become like a stare into a blank. It could be a sudden motion which is not expected. It could be a very different kinds of activity. It could be a sudden twitching of one part of the body. Those are all convulsions and they have to be attended to immediately. There's a special point about the headaches. Headaches is so ubiquitous. Everybody gets headache at some point of time in life, and yet it could be very minor thing called tension headache, stress headache. On the other hand, these headaches could be even more serious. It could be like a spasm of blood vessels, which is called pain. It could be even be more serious, and it could be progressive, severe, associated with vomiting. That could indicate either bleeding into the brain or brain tumor pressing onto the structures of the brain. So the headaches could be very minor or it could be very major. Only a person who is having the headache could actually tell, this is not my usual headache. This is something much more serious, needs to be attended to right away. High fever of 102 or above, with or without other symptoms, it's a self-explanatory. Something is not right, body is trying to fight it out, either with an infection or a tumor or some other reason. Fever is actually a defense response from the body. So there is some fight, some reaction going on. Severe acute abdominal pain with or without vomiting or diarrhea. Again, abdominal pain could be very minor. It could be indicating some spasm. It could be because of you ate something unusual, minor form of food poisoning, or it could be due to what is called gastric acidity or hiatal hernia or reflux disease, or it could be much more serious, like a perforated bowel, like an appendix pain. It could be like a gallbladder pain. It could be a stone in the gallbladder tube or stone in the kidney. The abdomen is Pandora's box. There are so many organs, so many things. Any of these can cause pains, and it has not to be ignored, especially when associated with vomiting, diarrhea, fever, or other associated symptoms like shortness of breath or other pains. Unconsciousness, unresponsiveness with or without breathing. Of course, this is one of the most dire emergencies, and these people need attention right away. And we will go into the details of that where they require resuscitation. There's something majorly wrong with them. So we will go into that in a little bit more detail later on during this presentation. Sudden severe injury, major fall, trauma, especially of the head or spine, accidents, burns, smoke inhalation, all these constitute acute life-threatening situation and or major emergencies. Drowning in the water, choking on food, liquids, severe allergic reaction with or without rash. Allergic reaction can occur after taking some medication. Allergic reaction can occur due to exposure to some chemical that you apply in the skin. If it is associated with choking of the throat or unable to breathe, very severe. They can pass out. They can immediately become unconscious. Swallowing a poisonous substance or overdose of a medication, it's an emergency. Basically, it can when you just detect that somebody has taken the poisonous substance by mistake, like drinking some kind of liquid which may not be water, or they have taken some medication. They thought that it is vitamin tablets, and they have taken too many of the seizure medication or high blood pressure medication. It becomes an emergency. Feeling of or suspicion of committing suicide or murder, it's an emergency. This can occur in many psychiatric disorders. They may express it, or they may be perceived to be having that feeling. That calls for emergent attention, medical attention. Childbirth. Usually childbirth is a natural process and can occur at home, can occur eventlessly, and yet it constitutes medical emergency. And the same thing goes with abortion. With the abortion, actually the blood vessels of the uterus, they open up and the bleeding begins. The bleeding may not be controllable. Abortions are a lot more dangerous than even childbirth. After childbirth, there is a natural reaction and the placental vessels, they close ultimately. They stop, but abortions may not. How to deal with it? Be prepared for an emergency before it even occurs. How do you prepare for an emergency? Prepare and display the following in a prominent area. Phone numbers of the nearest emergency department, police, fire, usually a 911 call in America, poison control center, personal doctor's phone number, personal and work phone numbers of the neighbors. It may occur at a time when you need to reach out to the neighbor and they may or may not be at home. You need to have their work number as well. You need to know their personal friends and relatives that you can reach out to. Teach everybody, including children, when and how to call these phone numbers. They need to have a practice run. Keep emergency room phone numbers at home and also in your cell phone. It will always be handy. When you really want that ER phone number, you really need it on your palm. Determine the location and the quickest route to the emergency department and know where your doctor practices and has contacts. So in case there is not a situation where you call the 911 paramedics, you think that you can handle that, you should have the very good idea as to how to reach the emergency room. Those people who have medical conditions which are chronic and could cause problems like diabetes or asthma, they should wear a ID tag. They should even say that they are on seizure medications or something, so that in case they are found unable to respond, the next person, whoever attends to that patient, can identify what might be going on. Some devices are available now for people who live alone and those who have no other way to contact. Those who fall may not be able to reach the phone. It's called personal emergency response system. All they have to do is wear a sort of necklace and there is a little button. All they have to do is push the button. The message goes wirelessly into a call center and the call center person dispatches a paramedic. That's called personal emergency response system. Usually it requires a subscription, but that's a life-saving in people who have those situations. What to do immediately if you are someone needs help? It's a lousy cartoon. Not be able to hear properly. Stay calm. Most important, think logically. First, assess the responsiveness of the patient and the victim. How responsive the patient is. Check for the breathing, not more than 15-20 seconds. Check the pulse in the neck, no longer than 10 seconds. Look for breathing and pulse, two important parameters of life. If the patient is alert and responsive with resolution of the symptoms, if the symptoms go away, patient is more comfortable and says, I'm fine, call the doctor or the nurse. If the symptoms have continued, especially chest pains, vomiting associated with mental status changes, profuse sweating, shortness of breath, patient may say, I'm fine, but he's not fine. Call 911. If the patient is unresponsive with loss of both pulse and breathing, start CPR. And we'll go through a very quick slide on the CPR. If the breathing is present, but the pulse is absent, rescue breathing only, 10 to 12 times a minute. Whatever means you have, mouth to mouth, or if you have some other device, you can use the device to give the breathing only. If the person is breathing and the pulse is either present or comes back, put the patient in what is called recovery position on his side with the one hand raised above his head so that if he vomits, he does not aspirate. When the paramedics arrive, what do they need? Have the following information ready for the paramedics. Patient's name, age, biodata, medical history of the patient, including a complete list of medications, if you have the access to it. Patient's doctor's names, pharmacy names. And the sequence of events leading to the acute illness. Yeah, if you have that information available, if you have seen that the person actually stumbled and then passed out, it will be very useful as a witness to tell as to what happened. What is your best description? Did the patient take any medications before or after the onset of symptoms? Did he try to see if he'll get better? Collect the essential personal items to be taken to the emergency department and possible hospital admission. What are the typical diseases associated with emergencies? Well, hypertension. It could be too high or too low. Diabetes. Usually high blood sugars don't make them have an emergent situation. Low blood sugar can and will. Low blood sugar can cause symptoms mimicking stroke. It can cause symptoms mimicking anxiety. They may break out in sweats. They may complain of, they may talk slurred. They may talk irrelevant. Very subtle signs. They may have almost all complete stroke. They may become unconscious. Sign of low glucose. Heart diseases. There are several kinds of heart diseases which can actually result in emergencies. Of course, we are most familiar with the coronary disease, which manifests with the chest pain, shortness of breath, or both. Diseases, valvular diseases, that can make people pass out. Electrical diseases, we know that electrical abnormalities cause arrhythmias. Tear in the vascular system can cause severe pain, severe drop in the blood pressure. If one has a way to record their electrocardiogram, it will usually show like a pulseless electrical activity, where you will see the electrical activity of the heart and yet there is no pressure because there has been a tear or rupture of the major structures like aorta. It's called aortic aneurysm. There are aneurysms which may be dissecting, it may be tearing, it may be causing very severe pain, usually occurs in a setting of very high blood pressures. It can lead to rupture. If it ruptures big, there is really no recourse. Person dies within minutes. But if you suspect, if it is there, there are cord aorta team in major hospitals, paramedics are familiar with that. They may do their best to get the patient to the right facility for the right intervention. We talked about blood clot in the lungs, called pulmonary embolism. Very severe condition, very common condition, very missed condition. It's one of the commonest cause of deaths in the hospital, in the hospitalized patient for some other reasons, like a hip surgery, hip replacement, knee replacement, abdominal surgery. They are prolonged immobilization. They are laying in bed. They suddenly throw a blood clot. Their heart becomes very fast. Blood pressure drops. They do CPR, person dies. Pulmonary embolism is very, very important consideration. Poojaji, can we play the pulmonary embolism slide? Poojaji?
Hey there, today we will be talking about pulmonary embolism
so
or PE.
Let's move on.
You may have heard of PE before,
Any
or know
hemorrhage
someone who
or
has suffered from or been
we are
diagnosed with
playing.
it. If
Okay,
you have,
sorry.
then you may know that PE can be a fatal condition that requires proper medical attention. So what exactly is PE? It is caused by a physical blockage in the pulmonary
playing?
artery, which is the artery responsible for carrying blood from the heart
Yes,
to
it
the
is.
lungs. This physical blockage is often caused by a
It is
blood
playing
clot,
on-
usually starting in the lower legs. This
may
blockage
not
can
be
block the
able
flow
to-
of blood to the lungs and can be extremely dangerous. Around the world, PE is the third leading cause of death. In the general population, it is estimated to affect 60 to 70 per 100,000 individuals and affects both males and females. However,
If
this
it's not-
value may actually be higher
Sorry.
since diagnosis
It is
of
playing
PE is
completely.
difficult.
It's playing.
For this reason, it's
Let me know
important to
when it's
understand
done.
the risk factors as well as the signs and symptoms associated with PE. Across studies, the biggest risk factor for having PE is age. For every 10 years after the age of 60, the risk of having a PE doubles. However, age is not the only risk factor. Obesity, high blood pressure, smoking, history of blood clotting, surgery, and inactivity are some other factors that make the matter worse. Specifically, obesity and high blood pressure are associated with an increased risk of PE, especially in women. Infections in the body that lead to higher blood clotting responses also lead to a higher risk for PE. Being immobilized after any kind of surgery also leads to an increased chance in having PE. In addition, prolonged sitting, such as during long car rides and plane trips, can also lead to PE. But how do you know if you're having a PE? Common signs and symptoms of PE include shortness of breath, sudden and sharp chest pain, and a cough that may or may not produce bloody and foamy mucus. Other signs and symptoms include leg pain or swelling, clammy or discolored skin, fever, excessive sweating, a rapid or irregular heart rate, and or dizziness. The symptoms of PE are similar to the symptoms of other conditions, so if you experience any of them, make sure to seek immediate medical attention. It's also important to know that some people who have PE do not have any signs or symptoms, which can make it very difficult to diagnose. So how do you actually determine whether you had a PE? A PE is most commonly diagnosed when you're in the emergency room. It requires a medical history, a physical exam, and some diagnostic tests. Using your medical history lets the physician know of any present risk factors for PE and rules out any other possible causes for the symptoms you are experiencing. The physical examination involves checking the legs for any signs of clotting, checking blood pressure, and heart and lung function. If a physician still believes that a PE was the cause of the symptoms, then they can conduct various diagnostic tests to confirm this. These tests include a CT scan, ultrasound, and/or blood tests. The main goal of treatment for PE is to stop the blood clot from getting bigger and to prevent new blood clots from forming. There are various forms of treatment for PE, which include medications, procedures, and other therapies. Medications for PE include anticoagulants, which are blood thinners, and thrombolytics, which are clot dissolvers. Blood thinners are drugs that decrease your blood's ability to clot. They prevent clots from getting bigger and prevent new clots from forming, but they cannot break up already formed clots. Specific types of blood thinners include heparin, which can be either given as an injection or through a needle inserted into the vein, or warfarin, which is taken orally as a pill. Clot dissolvers are medications that are given through the vein and have the ability to dissolve clots quickly. However, clot dissolvers can cause sudden and severe bleeding and are reserved for life-threatening situations in an emergency room or hospital. In the case of a very large and life-threatening clot in the lungs, a doctor may suggest removing the clot using a minimally invasive procedure. Besides treating PE, there are many other things that can be done to prevent it from occurring. For example, since prolonged bed rest after any type of surgery puts you at a higher risk for PE, It is important to start moving around as soon as possible. It's also important that you take any prescribed medications to prevent clots from forming. As well, exercising your lower leg muscles, especially after long periods of sitting, is helpful in preventing PE. Compression socks can also be worn to reduce swelling that a blood clot in the leg may cause. The sock is worn from the foot to the knee and causes gentle compression or pressure up the leg that prevents blood from clotting. For individuals who have had a PE before and are at risk for blood clots but cannot take medication or respond to them, inferior vena cava filters can also be used to prevent another PE from occurring. A vena cava filter is a device that can be inserted to keep blood clots from traveling to the lungs. The filter is inserted inside a large vein called the inferior vena cava and catches clots before they reach the lungs. These filters are a safe and effective method of preventing PE. In the end, PE is a severe condition that needs to be properly diagnosed and treated. If you think you, a friend, or a family member have symptoms of PE, it is very important that you seek medical attention immediately. For more information on PE, please visit these websites.
You're on.
Okay. Yes. So moving on, hemorrhage, bleeding, when it is severe, it is an absolute emergency. It could be life-threatening. Bronchial asthma. Again, bronchial asthma could be in any form. It could be very minor that the person knows about, has rescue inhaler, or ways how to deal with it. And yet, sometimes bronchial asthma attack that occurs associated with an acute infection can be very life-threatening and may not be controllable, and that becomes an absolute emergency. Otherwise, they drop their oxygen saturation, they can become unconscious, and sometimes they just pass away. Stroke due to clot or hemorrhage in the brain, seizure disorder, we talked about. These conditions, they are very dangerous and they can be life-threatening. And seizure disorder, acute seizure, usually may not be life-threatening, and yet there is a condition called status epilepticus, where the seizure comes and goes, comes and goes, comes and they go into cycles of that. That's absolutely a life-threatening emergency. When there is extensive infection, what is called sepsis, when the infection has spread, there is a growth and proliferation of the organisms, the bacteria within the vascular system, that's called sepsis. It basically involves every body system, major vascular system, lungs, kidneys, including heart and bone marrow. That sepsis can lead to low blood pressures, can lead to death, need to be immediately be attended to. Many times abnormal body chemistry, which could be related to abnormal electrolytes, low potassium, low sodium. Low sodium can be caused by what is called water intoxication, too much of water, dilutional hyponatremia, we call it. That all those conditions, they could be lethal, it could be dangerous. So those conditions lead to emergencies. We know that drug overdoses, exposure to toxins, gases, fumes, burns, they by definition are emergencies. Falls, accidents, trauma, attack with guns, knives, perforation or obstruction of the internal hollow organs, blockage of the urinary drainage, stone in the gallbladder tube. They all can cause various manifestations with chest pain, abdominal pain, vomiting, diarrhea, bleeding. So they show up in those forms, but these are the diseases which are associated with those manifestations. There could be a sudden collapse due to system malfunction. What is system malfunction? It could be it's called vasodepressor syncope. It could be like a site of something unpleasant that body somehow perceives as absolutely intolerable. And at the site of blood, at the site of some thought, they can have suddenly they can pass out. They actually become pale, they become sweaty, and they suddenly collapse. Abnormal body temperatures. Of course, the high temperatures due to infections. Low temperatures occur mostly like with a left out in the snow, exposure to cold weathers. Psychiatric illnesses, many psychiatric illnesses are emergencies, especially when there is a damage, the person can damage or hurt himself, herself, or anybody else. Those are psychiatric emergencies. We know childbirth and abortion, we talked about, they are emergencies. Well, if there's a hypertension, most of the times their advice is given, do not let the blood pressure go too high, do not let it go too low, avoid skipping medications, avoid taking too many medications, avoid any, and follow the general instructions like follow low salt diet, follow a diet which is rich in greens, fruits, and vegetables. So there are lifestyle modifications, exercise regularly. Those are the only ways how you can avoid, and yet there could be a situation when the blood pressure tends to fluctuate in a too high or too low range. Diabetes, low glucose, we talked about. Avoid skipping or irregularity in meals. Avoid errors in medications, taking too much, too little. Immediately check finger stick blood glucose and follow the instructions given. If it's a heart disease, usually let the patient lie down in a safe and comfortable position like a bed. Immediately check pulse and blood pressure if there is a blood pressure machine available. Many times these people are known to have heart disease and they may have a nitroglycerin. If they are complaining of chest pain and if there is a nitroglycerin handy, take it or give it. If the patient has severe shortness of breath and you have oxygen because person has known COPD, emphysema, lung disease, give oxygen, give breathing treatment if available and previously instructed. If not, follow the algorithm. Bleeding or hemorrhage, if you have some way to control it, put the patient supine, lying down, tilt the head down, put a couple of pillows under the legs and feet so that the blood flows preferentially to organs like brain. If patient has asthma, give oxygen, breathing treatment. If there's a clot or hemorrhage in the brain, let the patient lie down, call the 911 immediately. The time is very important. If they suspect that there is a blood clot in the brain and not a hemorrhage, by a CT scan, within 3 hours of the onset of symptoms, they can be treated with administration of blood clot dissolvers. Extensive infection, abnormal body chemistry, electrolytes, if it becomes associated with major symptoms, call 911. Same goes with the drug overdose, toxins, fumes, gases, falls, accidents, trauma, all of that. The first aid team has the day off. Well, now the second aid team. Well, I don't know whether that's a good or bad. Second aid team may be a more advanced cardiopulmonary supports team. Maybe they are better equipped to handle the unconscious patient. What do the paramedics do on the site? They actually obtain quick details of the medical problems from any witnesses, family members, including medical history. They take the list of the medications. They assess the patient's responsiveness. They check the pulse, breathing, assist with proper and safe positioning. They administer oxygen. They start an IV line, connect to a heart monitor. They check the oxygen saturation. They may obtain an EKG on site. They may check the finger stick blood glucose. They may have suction machine. They may try to stop the obvious bleeding site. They may cause immobilization if a fracture of a bone is suspected. They may administer nitroglycerin. They may administer IV fluids. They may actually have some antidotes available for narcotic overdose, let's say. They may have ways, drug like naloxone. They may have drug like flumazenil. They are supposed to give for drug overdoses. They can immediately make the person breathe many times. They can contact the nearest emergency department or a hospital for further instructions, and they can quickly determine the need to transport to the emergency department, and they can, if necessary, initiate or continue CPR. During the transport, they support the patient's vital signs, administering IV fluids, oxygen, continuing CPR. They communicate continuously with the emergency department, notifying them of their arrival time, ETA. Follow the other instructions from the emergency room or from their medical director as to what to do during the transport. What do they do in the emergency room? Well, they do a quick triage to an appropriately equipped treatment room. They transfer the patient to the bed. They start or continue CPR. They administer oxygen, IV fluids attached to the monitoring equipments. They call the laboratory personnel to draw blood samples. There are routine blood samples and there are special blood samples based on the patient's condition and presentation. They do other diagnostic, ECGs, arterial blood gas, which is a puncture of the artery to obtain the blood sample to measure whether there's any acid buildup and whether there is adequate oxygenation. Need for urinary drainage, they may put the catheter in the urine. They may obtain proper imaging studies thereafter, which could be in the form of any ultrasound studies, X-ray studies, CT scans, MRI studies. They may even do angiogram with the MRI. Then they do the thorough review of the clinical picture, either by a physician or by PA, and they administer the appropriate medications as required in the emergency room. And then, of course, they may even start central venous line for access of administration of medications. They may even do some orthopedic measures to stabilize the patient's broken bones. They may give respiratory treatments other than oxygen, which may in the form of BiPAP machine to give oxygen under pressure into the lungs. They may have to intubate the patient to connect it to the machine, respirators. They can call poison control center if the drug overdose is suspected. They stabilize the patient, make a diagnosis, look at the data, get all the imaging results, treat the condition, and then decide whether the patient needs to be admitted, in what level of service is required, whether ICU or general bed. During this time and after that, they are communicating with the inpatient team for continuation of care. They do have to communicate with family members. Communication with family members is of paramount importance. They have to be informed of what's going on. There are the conditions which are most associated with critical time: acute heart attack, acute pulmonary embolism, acute aortic tear, and acute CVI. Because these four conditions are immediately life-threatening, and if intervened in a timely fashion, they are salvageable. Once we do the CPR and once we get the patient back, we are not done yet. We have only taken care of arrhythmias, and the patient has what is called ROSH, return of spontaneous circulation. That is a success of the CPR. And yet there are 5 or 6 H's and 5 T's which a doctor looks into. And without going into too much of a detail, I just want to enumerate those. Those are low oxygen, low blood sugar, low volume, low potassium or high potassium, low temperature, and low hydrogen ion, that is acidity. If they have too much of any one of these or too little of any one of these, that can make recovery very difficult, if not impossible. And there are 5 T's, which actually denote the conditions which lead to situations leading to cardiopulmonary arrest. And those are heart attack, pulmonary embolism, cardiac tamponade, which means that the heart is being choked by the leakage of the blood between the heart and the sac of the heart, and the tension pneumothorax, which is like air leaking continuously between the lungs and the sac of the lungs, and toxins. So these 5 T's are to be considered if the person has to be gotten back. The drugs they use, I'm not going to go into the details. I'm going to conclude that by this little clip. Okay. What do we mean by rocking? Could you please run that video on CPR?
In today's video, we're going to review healthcare provider BLS for the adult victim. So let's take a look and see what those skills look like, shall we? First, establish unresponsiveness. Next, look for breathing. We're just looking at the patient's chest for about 5 seconds to see if they're breathing. If they're not breathing, call a code. Get some help coming. Next step, check for a carotid pulse. But remember, spend no more than 10 seconds checking for that pulse. Next, begin chest compressions. We're going to do our compressions at a rate of at least 100 at a compression to ventilation ratio of 30:2. And we're going to get the AED or the defibrillator on the patient as quickly as we can. So let's take a peek and see what that looks like, shall we?
Doctor!
Yes.
They just dropped this man off outside the ER.
Oh, let's see. He's unresponsive. We'll look for breathing for 5 seconds. This man is not breathing. Nurse, call the code. Hi, welcome back.
Thank you.
Next, we check for a pulse. How long do I check a pulse for?
No more than 10 seconds.
This patient has no pulse. We must begin CPR. Nurse, I've started chest compressions. Hey, get me an AED or a defibrillator right now. What is my compression to ventilation ratio?
Doctor, we're gonna give 30 compressions to 2 breaths.
30 compressions to 2 breaths. How far into the chest should I be pushing on this guy?
2 inches.
2 inches. What's my rate of compressions? I don't know what I'm doing.
At least 100 a minute.
At least 100 a minute. And 30. I'm getting tired. Somebody get over here. It's a lot of work.
Yeah.
Now remember, in the adult cardiac arrest, over 90% are in VFib or pulseless VTAC when they hit the ground, and the only thing that is going to fix them is rapid defibrillation. CPR in the adult cardiac arrest is a by-time maneuver only. It helps to keep the patient in VFib so we can shock them. But again, we need to shock them as quickly as we can. So get that AED and get it on the patient. Nurse, where the hell is that AED?
The AED's here now.
Hand me those shears. Let me get this guy's shirt off. Now remember, when applying the defibrillator pads on the adult chest, you're going to place them high right, low left. High right, low left, for a couple of reasons. One, most implanted devices, implanted defibrillator or pacemaker, are placed under the patient's left clavicle. You might be able to feel and appreciate that, but for that reason we place the pads high right, low left, with the intent of making a heart sandwich. That's right, a heart sandwich. We need the heart in between the pads. If I put a pad here and a pad here, energy goes from one pad to the other. I'm going to defibrillate this guy's sternum. I need to get the heart in between the pads. So again, the pads go high right, low left, heart sandwich.
Place electrodes. Place electrodes. Do not touch patient. Analyzing rhythm. Stand clear. Push flashing button.
I'm clear, you're clear, we're clear.
I'm clear.
3, 2, 1, shock.
Okay, you're on. You're on.
Okay. All right. So that actually concludes this session. It's a marathon session, which actually covered a very wide scope all the way from life, health, disease, and medical emergencies. And now I am open to any.
Thank you, Dr. Agrawal, for a very informative and insightful presentation. We will now dive into Q&A. It is told that CardioVax capsule is helpful in hypertension and cleansing the various arteries of the body and give immediate relief, and helpful in increase of the age of a human. Is it a fact?
There is no capsule or chemical known to mankind which can dissolve a preformed plaque or obstruction of an artery of the heart or artery anywhere else. They only require mechanical intervention. It requires to be opened up with a balloon, or it needs to be bypassed. So a majorly blocked artery, there is no chemical, no chelating agent. There used to be a lot of propaganda about penicillamine and some other chemicals that used to be that are normally used to chelate iron poisoning or calcium or some others, but there is no such a thing that can dissolve or unblock artery of the heart or artery anywhere in the body. So those are all myths.
Okay. Moving on to the next question. Palpitations, are they only stress induced or can they even be food induced? In that case, what kind of food to avoid?
As I said, the palpitations could be very minor, and it could be very simple thing like a stress response, anxiety problem, and unpleasant encounter with a situation which may actually make you nervous. It could be just that. The second part of the question is what kind of a food can cause that? Usually, if you call caffeine a food, caffeine is something that is regularly causes the heart action to be quicker, faster. Anything that is adrenergic, like adrenaline, that will make the heart go faster. In fact, that fast heart rate, which are associated with anxiety and these situations, they are just what is called sinus tachycardia, meaning it is the normal pacemaker of the body going faster under the effect of chemical or nerve influence. Those are not dangerous kind, and those are manageable by the person, by understanding, or by the doctor after consulting them. It is the palpitations of arrhythmia, where the rhythm of the heart is not a natural rhythm. It is not coming from the natural pacemaker, which many times are associated with more symptoms like shortness of breath, dizziness, sweating. So it's the associated symptoms which make the significance of the palpitations much worse, and that needs attention.
Okay, moving on. Are regularly having leg cramps, especially during sleep, is this a red flag, and how to manage this?
The leg cramps during night, during sleep, is most of the time a response to lack of rest of the muscles. It is lack of sleep can do it, lack of rest of the muscles do it. Those are called nocturnal cramps. As against cramps which occur regularly upon walking or upon exertion, and that pain which actually gets worse and then slows by slowing down or by stopping walking goes away. Those indicate blockage of the arteries of the leg. So nighttime cramps almost never are associated with blockage. Sometimes too much of a diuretic, if the person is dehydrated, that can cause cramps in the muscles of the legs. If there is an electrolyte abnormality, especially low potassium, that can cause lags. Low potassium occurs regularly in people who take diuretics for some other reason. So actually one has to look into their hydrational status, making sure that they are not dehydrated, make sure they get good rest. And number three, they are not taking too much of water. Actually, water intoxication, too much of water can also cause electrolyte imbalance and nocturnal cramps.
Okay, our next question is also about cramps, and they want to know what is the reason for cramps in fingers and toes?
Fingers and toes, the cramps that occur typically are associated with low serum calcium. It's called hypocalcemic tetany. There is a word, but that is actually completely provable spasm. It's called carpopedal spasm. But that is different than just having cramps. The cramps anywhere in the body is again due to lack of rest, as sore muscles, but it may indicate underlying joint problem as well. So an early onset of arthritis of the underlying joints can also be felt as cramps of those muscles.
Okay. Moving on to the next one. Here our viewer says that her father-in-law died of heart attack at the young age of 49, and his brother also died of heart attack. So she wants to know if this could be genetic and if her husband should take aspirin as a preventative measure.
Excellent question. Yeah, the fact that the father and brother had heart attacks in their 40s, is that correct?
Yes.
That any male person having a heart attack at below the age of 45, or women folk having the heart attack below the age of 55, constitutes a very positive family history. That positive family history does not automatically translate into having a heart disease in the progeny, but it's a very strong risk factor. More the risk factors, more are the chances of heart attack or coronary blockage. Hypertension, diabetes, smoking history, history of high blood pressure, diabetes, smoking history, family history are the major risk factors, which actually more of them are present, more are the chances of heart attack. But just because having a family history alone without high blood pressure, diabetes, high cholesterol, smoking, make person less likely to have heart disease. So having a family history does not guarantee that you will have a heart disease. There are ways to control blood pressure, cholesterol, blood sugars, diet, exercise, body weight. Those factors are much more important in that person. And if those factors can be controlled and optimized, the chances of getting heart disease may be minimized, not made zero, but very little.
Okay, great. I think that's a common question we all tend to have. So great answer there, Dr. Agrawal. Moving on, our next viewer wants to go back to your previous question about the artery plaque, and he's asking about Ayurvedic remedies regarding that, and he says that he once heard from a naturopath that cayenne pepper can resolve artery plaque, and he wants to know if this is a myth.
Yes, as I said, out of all these substances that I have heard of, cayenne pepper, of course, didn't make it till today. So, but yes, it is a claim that I am sure some person has made it, and I don't think that there is any scientific substance to it. There is no substance known to mankind which can dissolve those plaques of the arteries of the heart.
Okay, next question is there any non-invasive method to determine artery clogging?
Yes, very good question. In fact, this goes on to the cutting edge technology. We have the CT scanner and MRI scanners. There are two imaging devices available which actually can image the coronary arteries in situ. In other words, without opening it, without actually putting in any catheter tube into the body. So they are non-invasive, meaning they are non-interventional. The most commonly used modality that is available is a CT scanner. And CT scanner, the low resolution CT scanners measure the coronary calcium score. And the calcium density in the coronary artery tree can be measured and given a number. And usually that number is 0, but any number between 0 and 100 is considered significant, but yet not bad. But above 100 in any particular artery is concerning for underlying blockage. These calcium are very easily visible on a high-speed, high-resolution CT scanner, such that they can even see the entire coronary tree. And the calcium, as well as the interior of the coronary artery, can be seen at a very high resolution with the high-speed CT scanners, which are quite available in major metroplex areas.
Okay, our next viewer asks that for a layman, what are the ways to provide CPR besides mouth-to-mouth respiration? What can a layperson do? Can he buy a bag and a mask without prescription?
Yes, bag and masks are available and they do not require prescription. And I think any medical supply store will have them. Usually the laymen are supposed to, number one, identify the situation where there is a condition for CPR, that the person is not responsive, not breathing, and no pulse. These three are stepwise determinations, absolutely prerequisite to conducting CPR. If the person is non-responsive, has no breathing, and he has no pulse, the most important step as a single rescuer, you are the only person doing the rescue, just do cardiac compressions. Find the right spot, put your body weight, push it 2 inches down and up 100 to 120 times a minute. If you do that without interrupting CPR, now the second person is there, that second person can do 2 breaths every 30 compressions with either mouth to mouth or with a other bag valve device, whichever way. But the compressions are given a lot more importance and they are a lot more life-saving than worrying about the breathing for a single person.
Okay, great point there, Dr. Agrawal. Next one is, does vitamin K2 help decalcification of the arteries?
No, it does not. There is no chemical substance that can actually avoid or prevent calcium deposits in the arteries. The calcium deposits in the arteries are a reparative mechanism. It repairs. When the arteries have a plaque inside it, it ruptures and it actually makes a scar, and that scar tissue actually gets a calcium deposit. So calcium deposit in a coronary artery is only indicative of the chronicity of the disease process going on, how long it has been going on. That calcium deposit occurs within the wall of the arteries. It is not a free-floating calcium within the tube, within the lumen of the artery. So to answer that question, vitamin K, vitamin K2, or any other vitamins known to mankind cannot prevent calcium deposit.
Okay. Next question says, is the numbness of the fingers some signal, as I have been having hypertension since many years, but the numbness goes by itself?
It's a very non-specific symptom, and the numbness of the fingers associated with high blood pressure, there is no direct correlation. Depending upon whether it is in the both hands or the main writing hand, whether it is something related to use of the computer or use of the handheld device, It may be somehow related to that. Sometimes there is some condition called carpal tunnel syndrome, where their nerves going to the fingers are pinched right at the wrist level, usually both sides, and that usually shows up as a numbness or tingling of the fingertips. So actually, it is not really clearly related with the hypertension.
Okay. The next question, our viewer says that her son-in-law has a very high cholesterol, LDL, and does he need a doctor, or if diet modifications will help?
Okay, so that's a very good question, because that goes to the national guidelines in terms of what constitutes unacceptable cholesterol levels. Again, it is taken in light of the fact that does that person have other risk factors for coronary blockages. But in general, they are classified into LDLs of like above 160, between 130 to 160, between 100 to 130, or below 100. So these are the four major slabs they are used. Now, certainly, if the LDL levels are well above 190, that is considered in the area of some metabolic disorder, like a familial heterozygous or familial homozygous hypercholesterolemia, and that requires attention. But if the LDL levels are anywhere between 100 and 190, yes, first attempt is lifestyle modification. One has to really modify the diet, avoiding the saturated fat, no trans fat, as low of a carbohydrates as possible, something like a Mediterranean diet. That kind of a diet, a lot of exercise, reduction of the body weight, about 5% body weight reduction, with a body mass index, if they can get that, about 25 or less. Actually, the ideal is between, let's say, 23 and 27. Maintaining that is much more important. Now, despite all that, if the LDL levels are beyond expected range, beyond 130, let's say higher than 130 with no risk factors, one can go on with that and continue the efforts. But if it is well above 160, despite best efforts, that person definitely needs medications. If person has risk factors, other risk factors, and the level is between 100 and 130, he definitely needs medications. There are stepwise approach to what medications will work. The medications are given in a sequential fashion. Statin drugs are still the cornerstone of the LDL management nowadays, with all their benefits. So yes, the person who already has blockage disease shown, their LDL level needs to be brought around 70 or below. So we have a much more aggressive approach for those people with a known coronary blockage. So depending upon the other risk factors, and depending upon the LDL levels, and depending upon how it responded to the lifestyle modifications, yes, it may need attention with medications.
Awesome. Moving on to the next one. Is low sodium indicative of any cardio-related problem or serious health condition?
Serious health condition, yes. Low serum sodium, again, let's say 135 to 145 is normal. People who have a borderline low serum sodium, 130 to 135, usually are consuming a lot of water. So this is called dilutional hyponatremia. Most of the time, either they are taking a diuretic and they are trying to compensate by taking too much of liquid, or even without diuretic, they are taking too much of liquid. That causes low serum sodium. So between 130, 135 is still manageable, and with the modification of the dietary pattern, liquid intake. Once it goes below 130, it gets a lot more serious. The lower it is much more dangerous, to the point that if it goes below 120, it's a life-threatening. Immediately, it can cause major arrhythmias, and actually it constitutes medical emergency. So low serum sodium, the commonest cause is either excessive water or fluid intake with or without diuretics. There are other conditions which cause low serum sodium. There is a syndrome called syndrome of inappropriate ADH secretion. There is a hormone from the brain which actually tends to conserve water, and if that is too much, it creates a situation of fluid overload, dilutional effect, and the serum sodium becomes low. So yes, serum sodium is important. Low serum sodium is bad. Too low serum sodium is dangerous.
What can be the cause of mild heart attack? ECG was abnormal and angiography showed no blockages for my mother.
That's interesting that the angiogram showed no blockages. Now, does it mean that there was no heart attack? No. There are entities where the heart attack can and do occur with normal coronary angiogram. There are several theories behind it. And the theory that most commonly was associated with this condition was called coronary spasm. So the artery went into spasm, caused the lack of blood flow to that segment of the heart died, and the coronary artery opened up. So a small portion of the heart muscle dying is a small heart attack. And coronary arteries actually supply blood, but the supply was interrupted, probably long enough to cause the damage. So yes, there could be heart damage and could be normal coronary arteries. There is actually a big heart attack, big heart damage that can occur with a normal coronary arteries, and there has been a special name given to that. That's called Takotsubo syndrome. People are still trying to figure it out as to why it happens, but people can get major heart attack. People can even die of this heart attack. And yet have normal coronary arteries. There could be coronary spell. There could be a small blood clot which might have gone on there. There could have been a dissection of the coronary arteries. And most commonly, we think that there may be a small vessel disease, meaning that the coronary angiogram only looks at bigger arteries, bigger segments of the coronary arteries. They cannot visualize too small a segment, which actually goes into the heart muscle, dips down into the heart muscle, and actually is the ultimate provider of blood and oxygen to the heart muscle. They cannot be seen. So yes, that can cause heart damage as well.
Okay, if someone is having chest pain, is it good to take aspirin while waiting on the paramedics?
Chest pain, non-specific chest pain, if they have never had this chest pain before, taking a aspirin immediately may or may not help. Remember, the chest pain could be due to gastroesophageal reflux. It could be due to acidity. It could be due to peptic ulcer. It could be due to tear in the aorta. All those situations, taking aspirin actually not only did not help, but it might have hurt. So the role of aspirin in an emergent situation is very questionable. Now, if somebody is known to have coronary artery disease or blockage disease and knows that this is the same kind of pain, and the pain does not go away with measures like taking a nitroglycerin, and you know that it might be a heart attack, yes, that heart attack must be primed with an aspirin intake. In fact, when an ECG is done and there is a definite suspicion of an impending heart attack or a heart attack in evolution, we definitely give aspirin. So aspirin is a must if one can be certain that this pain is actually coming from the heart.
Okay, I think we have time for just one last question.
Yes.
When do I call 911 or go to the hospital for COVID-19?
All right. COVID-19 is a very multi-systemic, multi-pronged disorder, as we have learned over the last 1 year. COVID-19 is associated with infection of the virus actually invading the body tissues and the body actually mounting an immune response. Now, whether it is directly related to the cells affected by the virus or whether it is caused by the immune response, the defensive response of the body, which actually starts damaging, nobody is quite clear as to what is the proportion of their contribution. Majority of the problem that we call it pneumonia, the lung problem, that cannot breathe, the oxygen saturation drops. It is theorized that that is usually a overzealous response of the body to fight that infected viral cells. So 911 is only indicated when somebody is deteriorated in any of the terms. Either their responsiveness has gone bad, or they are unable, them having a stroke-like symptoms, or their oxygen counts have gone down, they are getting confused, they are vomiting, they are unable to stand or lie on sit down, they fall down. Any of these manifestations, even heart attacks, are known to occur with COVID-19. So the COVID-19 has very varied manifestations depending upon which part of the body they involve and what is the degree of involvement. But any of these symptoms that are controlling, not uncontrolled, and going worse, you go follow the symptoms. Let the emergency room or let the paramedics decide whether it is COVID-19 or not. Let them handle it.
Okay, with that, that brings us to the end of our session today. On behalf of JKYog and Radhakrishna Temple, I would like to express our gratitude and appreciation to Dr. Agrawal for being here today and for giving us a very informative and detailed presentation and for walking us through dealing with medical emergencies. Thank you, Dr. Agrawal. I'm sure our viewers are now better equipped to deal with a medical emergency. And thank you all for tuning in. Have a great weekend. Bye-bye.